Rely on your child's healthcare professional for guidance and direction. Call your child's healthcare provider if your child experiences upset stomach that lasts 24 hours, vomiting, signs of dehydration, unusual weakness, fever, blood in stool, might be bright red on the outside or black and tarry, blood in or around the feeding tube, unusual excessive or foul-smelling drainage from the stoma, formula or stomach contents leaking around the tube site, red, sore, or swollen tube site, tube clog that you can't flush with warm water, diarrhea that lasts days, no bowel movement in 2 days, unintentional or significant weight loss or gain. There are many people and organizations available to help you adjust to tube feeding your child at home. The Oley Foundation is a nonprofit organization that enriches the lives of families dependent on home tube and IV feeding through education, outreach, and networking. Contact them for tips on everything from traveling to tube feeding at school. All services are offered free of charge for patients and their families.
It's very important for tube feeders to get involved with the Oley Foundation. It helps you feel so that they're not isolated. It helps them adjust and see that there is a possibility for a very normal and full and productive life. There's a real sense of loss at the beginning. You know, if you've lost your ability to eat, it doesn't matter whether it was a stroke or an accident. It's a very difficult thing. So coping with that loss and coping with the fear of the unknown, I think it's very, very important to speak with other people who have been doing tube feeding successfully for a long time. They can realize how inspiring it is to see that it's just another part of their day. They just had to learn how to do something a little bit differently. Some of the typical questions that early tube feeders have are things like, can I bathe with this tube? How do I clean now? You know, can I take a shower? Can I take a bath? And questions like that, as well as how to avoid some of the complications like a leaky tube, or how to support your tube so that it doesn't get tugged or pulled. We have answers to those sort of things. If the child has always had a tube, if they've been on since as long as they can remember, it often doesn't start to bother them until a classmate, maybe in elementary school, notices, or they aren't allowed to go to an overnight because they need to be hooked up at night. And there may be questions at first, and of course it depends on how comfortable the child is with themselves, but I'd say by the teen years, often there's been some sort of pushback about, I want to hide the tube, it's a natural feeling. One of the things, a strategy that works well is meeting other kids that are on tube feeding so they realize they're not the only ones. One of the terrific resources that the Oley Foundation offers patients and their families is a website that just can't be beat. It's got information on everything from how to avoid complications when you're tube feeding to how to travel. We have an equipment supply exchange, just a wealth of information. Any question you could think of on tube feeding practically has an answer on there. And if we don't, we've got a section where you can send us a question or a comment. It's really important for children who are tube feeding to meet other children who are tube feeding. It helps them feel more normal. They may not even talk about the tube feeding, but just to see that there's another child out there doing what they're doing helps them feel more normal, more validated, if you will. And if they have any restrictions on themselves, and it's usually not because of the therapy, but because of the disease process that made them depend on tube feeding, it's so helpful to see that another child has faced that and to see what coping mechanisms they've used. One concept that new tube feeders often don't realize is how prevalent it is in normal society. Because people, especially with low-profile tubes, it's not apparent that as many people are on tube feeding as there are people out there doing tube feeding. To recognize they're not alone. And even if they feel uncomfortable with reaching out to another tube feeder, I would highly encourage them to do that. because all of a sudden the light goes on. They realize that you can live totally normally. You can go back to work, you can go to school, you can go swimming, you can travel. They just don't understand. They think that life may have ended or a way of life has ended, and really the only thing that's ended is that their struggle with nutrition is over. You know, they've got a nutrition system now that will keep them as healthy as they were before, if not healthier.
Encourage other family members to help, and especially your child, if he or she is able. Some families feed the child at family meal times, while others give tube feedings in private. Talk about what works best for you, your child, and your family. To feed your child away from home, ask your supplier about the various feeding equipment available. When our children tube feed, we try so hard to let them know they're the same as anyone else, except for their tube. But there are times when you need to call out this difference. School is one of those times.
Everyone who cares for him knows how to operate his pump. They know how to prepare his formula. Everyone knows what to do.
She does go to school, public school, and they have a nurse that does her tube feeding there. So really the only challenge, I don't think there really is a challenge for her there, because they are set up with a nurse to do the tube feeding.
Talk with your child's healthcare professional about helping your child. Work with your school to make sure tube feeding can occur while your child is at school. It will take time for you to get used to tube feeding your child at home, but be patient. With the help of your child's healthcare professionals and with some practice, you will soon learn to set up feedings and care for your child's feeding tube.
I think having a support system is probably a huge advantage. If we hadn't had that, I don't know what we would have done.
It's nice to have the support of other people kind of backing you up and saying, hey, yeah, that's a safe way to do it. That's an appropriate way to do it. And so when you have somebody, you know, supporting you that way, I think that's important to get that encouragement.
He's healthier than he's been since the day he was born. He's getting proper nutrition. He's not vomiting. He's not having any of the issues that he was having before.
We have the Mickey button now. It's just a little button. It closes, it opens, you attach, detach. And then we show it all. It's her special button. She thinks it's the coolest thing in the world. She shows it to everybody. She runs around, she plays like a normal child. There's no issue other than the upkeep, the care, the cleaning.
My perception of tube feeding has changed tremendously. When we went into it, I thought these kids had backpacks on all the time. They couldn't do anything, but it's the complete opposite. Ashton does whatever he wants to.